Hello, I'm Dr. Aniketh Venkataram. I'm a cosmetic plastic surgeon. I'm currently based in Bangalore at 3 locations at the Venkat Center for Skin, ENT and Plastic Surgery in Vijayanagar and Banashankari, and at Eva Aesthetics in Bengaluru. Can severe gynecomastia be treated without large scars? Now, gynecomastia is an overgrowth of breast glands in men. Men also have breast glands like women, but they don't normally grow. In some men, if there's an imbalance in the hormones, the most common cause for this is puberty, then these glands get stimulated and they grow in size. The problem is that after puberty, even though the hormones normalize, these glands don't go away, which is why the only treatment for this is by surgery. This is not fat, it is gland. You cannot get rid of it by gym and dieting. Now, there are 4 grades of gynecomastia, from mild to moderate to severe. Severe gynecomastia is a little tricky to treat. The reason is not because of the gland. You can remove as much gland as you want. The reason is that there is a lot of extra skin. Something has to be done for that extra skin. Now, the traditional treatment for this was to remove that extra skin. But this means a large noticeable scar on the chest, which is something that we don't like doing because it kind of defeats the purpose of the surgery. We're doing the surgery so you can be bare-chested in public at a swimming pool with your friends without any embarrassment. And if there's a large scar on your chest, that does not serve the purpose. So how do we avoid this? We use technology. We have a machine which is a skin tightening device. So how do we do this? We make a small hole near the nipple, one more small hole near the axilla. So there's no large cut, there's no large scar, there's no suture. Through these holes, we do our liposuction, we do our gland extraction, and then we use our machine to tighten the skin. So we put this machine through that small hole. It uses radiofrequency energy to heat the inside of the skin. This causes protein coagulation, which causes collagen synthesis and skin contraction. This whole thing is done under local anesthesia. So you come, get it done, go home the same day. The local anesthesia also helps us to treat this without giving a large scar, because we're able to make the patient stand up after the procedure and then do the dressing in that manner. So we can lift up the skin and then do the dressing so that the skin is lifted up and it shrinks and contracts in a better manner. So under local anesthesia, it's a daycare procedure. You go home the same day. You need to come for 2 days to get the dressing changed. You need to wear a compression garment, which is like a tight inner banian, for around 1 month after the surgery. You'll see most of the result within 1 month, 100% within 3 months. Now, in a lot of patients, I would say around 85 to 90% of patients, this treatment works very, very well and it shrinks the skin nicely. No further treatment is required. But in around 10 to 15% of patients, the skin does shrink and get better, but it doesn't go tighten completely. The chance of this happening is particularly more in smokers. So in those patients, we might have to do a small touch-up surgery after 3 months wherein we remove a little bit of skin. But even then, this can still help us by doing the skin tightening first. In severe gynecomastia, the scar is a large horizontal scar on the chest. By doing the skin tightening first, we can almost always convert it to a small scar around the nipple. So we can still avoid a large noticeable scar. So in most patients, there is hardly any scar at all, just a small hole. In some patients, 10% of patients, there's a small scar around the nipple. And we are in almost all cases able to avoid a large visible scar on the chest. So this way, even those with severe gynecomastia can get good results with no telltale signs that they've had a surgery done.